I have with me today Mayor Pro Tem Dave Martin, Chief Pena, Dr. Persse. Let me just say good afternoon to everyone, and thank you all for being here on a rainy day. Today is the first day of the Harris County mandate requiring everyone over the age of 10 to wear a face covering while in a business or commercial property. That includes employees and all visitors as well as customers. And as we say in the city of Houston, mask up. And it's critically important for everyone to mask up in this city. And if I can add, not just to people going to businesses, but quite frankly, if you're out and about and in close proximity with other individuals, let me strongly encourage you to mask up. Because wearing a mask can help slow transmission of the virus. It protects other people from you. It can help save lives, and quite frankly, it's a sign of respect for other people as well. It does not matter if you wear a traditional mask or a bandana, as long as you wear an approved face covering and continue to social distance, that will help to save lives. Non-compliance with the order includes a $1,000 penalty for violators, but our goal is to save lives through education rather than enforcement and fines. Today we have another grim reminder that the virus is very much alive in our community and that our numbers are moving in the wrong direction. The Houston Health Department reports today 1,789 new cases of COVID-19 today, bringing Houston's total to 14,322. And let me repeat that again. The Houston Health Department reports today 1,789 new cases of COVID-19. We are moving very fast in the wrong direction. And let me just pause to say this. In March and April of this year, when these numbers were being reported in high numbers across the United States, in Houston, we had worked together very diligently and intentionally to flatten the curve and to slow the progression. And even though this number includes Sunday as well as today, because we don't report on Sunday, so Sunday as well as today, the average is over 850 cases for Sunday and Monday. During March and April and May, I never reported these type of numbers. Never. Okay? We work diligently and collectively to flatten the curve and slow the progression. But as we have opened up the way we have, we are moving very fast, and we are moving very fast in the wrong direction. Today's positive numbers are cumulative for the 2 days because the health department again did not report on Sunday. And this count includes a large data feed from the Department of State and Human Services. 86% of these tests were conducted in the month of June, with testing dates of June 9th through the 17th. But be that as it may, on Friday I reported over 900. On Saturday I reported 844. And today, for Sunday and Monday, I am reporting 1,789. Sadly, the number of deaths increased by 5 to 196. And the 5 new deaths reported today, an Asian male in his 70s with underlying health conditions, a Hispanic female in her 70s with underlying health conditions, a white female in her 90s with underlying health conditions, a white female in her 80s, underlying health conditions, and a Hispanic male in his 70s with underlying health conditions. Of the 196 deaths, 53 are associated with nursing homes and 3 with the Harris County Jail. We cannot become lax within our city, thinking that the virus is no longer a threat. Positive cases are increasing in our city exponentially. Baylor College of Medicine, Dr. Peter Hotez said that Houston would become the worst affected city in the United States, maybe rival what we're seeing now in Brazil, if we do not reverse the trend of positive cases and increases in hospitalizations. And so let me speak directly to the people in our city. The numbers, yes, are increasing across the state. The number of hospitalizations are increasing on a daily basis. The number of people testing positive, yes, we're doing more tests, but the number of people testing positive, that number has significantly increased. And the course that we are currently on is not one that's in the best interest of our city and neither in the best interest of our state. At the very minimum, what we are asking people to do is to put on their masks or face coverings when you're going to a business, commercial establishment. That's the order that's in place right now. But I want to go even a step further, and I want to encourage every Houstonian that when they find themselves in the company of someone else, that they become very intentional and put on their mask or face covering as long as they're in the presence of someone else. That is the very minimum. That is the very minimum we can do. And we've been saying that for quite some time. And quite frankly, even that may not be enough to stem the spread of this virus. And so it is important for people to take this virus very carefully, seriously, and then understand that the percentage or the number of people impacted by this virus, that younger population, that number is increasing as well. And so for all of the individuals who are attending these bars and clubs with no mask on, in close proximity, you may not have the virus, or you may be asymptomatic. But it doesn't mean that when you go home to your parents or to your grandparents that you may not be a vector and carry this virus to them and infect them with this virus. Their immune system may not be as strong as yours. And so all of the good work, the disappointment for me is that all of the good work that we did collectively in March and April and in May, but all of the good work that we did, shutting down, closing conferences and conventions, with all of that good work, we are now engaged in opening and activities that we're wiping away the success that we collectively achieved and the sacrifices that people made in March, April, and in May. So let me pause, and now let me bring up Dr. Persse.
Thank you, Mayor. As the Mayor points out, the testing numbers are going up. The numbers in hospitals are also going up. And we're seeing this in some of our data. Here's the screen. So this is a screenshot from the Southeast Texas Regional Advisory Council data. Now this shows the hospital data for Harris County alone. And you'll notice that there are 647 COVID positive patients in the general and isolation beds. That was 233 on May the 31st. So since May the 31st to today, that is a 2.8-fold increase in the number of patients that are hospitalized just since May 31st. If you look at the ICUs, today there's 337 COVID positive patients in the intensive care units. On May the 31st, that was 205. So that's a greater than 1.6-fold increase. You'll also notice, and it makes sense to you, that there is a little bit of a lag between when the general hospital beds are go up, and those numbers go up, and then the ICU. And that's because, on average, patients who are admitted to the hospital will be in a regular bed generally 8 to 10 days. And at the end of that time, they either get better and go home, or they get worse and wind up in the intensive care unit. So the slope of the curve that you're seeing with the general and isolation beds, I anticipate will be mirrored over the next coming weeks in the ICU beds. If we go to the next slide, we'll take a look at similar data from the Texas Medical Center group. Remember that this is not just those hospitals on Fannin Street. This is the Texas Medical Center hospital system. So this includes all of the Memorial Hermann Hospital System hospitals, both of the Harris Health hospitals, all of the Houston Methodist hospitals, Baylor St. Luke, etc. Those hospitals span out over about a 9-county region. And so this graph represents the ICU occupancy trend for most but not all hospitals across 9 counties. So this is not just a Harris County issue. And again, you can see that steep increase in the number of patients admitted to the intensive care units that are COVID positive. And you will note that they're quoting that it's approximately a 4.1% daily growth in the occupancy of the ICUs. If you were to look at all the hospital beds, to include ICU, general, and isolation, it's about a 5.2% growth. And currently, about 13% of all beds are occupied with COVID positive patients, including 24% of all the beds in the intensive care units. So the situation is serious, and then as the mayor pointed out, the numbers are moving in the wrong direction. We are working with hospitals closely. CETRAC, as well as the health departments, are working with the hospitals. The hospitals are not all filling up at the same rate. We have several hospitals in the Houston area that are already at and beyond capacity, and there are empty beds in some other hospitals, and so we're trying to even that load, and so we're moving patients between hospitals to try and relieve that. But the reality is that when you look at that and you look at where the hospitals are that are full or near full, they tend to be centrally located, in the hospitals with capacity, perhaps not to much surprise, are more peripheral to the city and out in the suburbs and further out communities. So the goal all along has been to make sure that if somebody needed a hospital bed, that there would be one available for them. So that's what we're trying to do. However, there is a limit to the number of hospital beds that we currently have, and hospitals are seriously considering activating their surge plans. The one challenge with those surge plans, they are very resource intensive, and it's probably not something that they will be able to do for a long period of time. So we have got to act now as a community. We have got to act now if we want to change the slope of this curve. And the last thing I want to point out is that one of the challenges is that the hospitals have a need to do elective surgeries. Elective surgeries is how hospitals make money to then offset the money that they lose taking care of other patients. That's why in the governor's order, he specifically prohibited elective surgeries. It was highly effective in that it created a lot of capacities in the hospital. It was also extremely expensive and an economic challenge for the hospitals. So I would like to plant the seed in the conversation that that is a fixable problem. Today, hospitals are struggling. They need to continue doing elective surgery to make up the money they lost to offset what they're losing taking care of viral pneumonia patients. But in America, we need hospitals to be financially incentivized to take care of viral pneumonia patients. This is a human decision. There are people who make those decisions. Those are business decisions that are made. Every flu season, we have the same conflict, that hospitals are full, yet critically ill influenza patients come into the ER where they have to wait until a bed opens up upstairs. There's no financial incentive for hospitals to take care of patients with influenza pneumonia that are critically ill, and now COVID pneumonia. So I put it to those that make those decisions, probably starting with CMS, to reevaluate the financial alignment of what incentivizes hospitals to take care of what types of patients and what types of patients America needs to be cared for today, which are the COVID, pneumonia, and other complication patients. Thank you, Mayor.
Thank you very much. And I want to emphasize that someone asked me the other day, Mayor, what more are you planning on doing to curb the increase of COVID cases? And what I responded is that the only thing that's within my arsenal at this moment is to be able, for example, to enforce the order that Judge Hidalgo put in place, with the city putting an order in place that says the same thing for people who are attending commercial establishments, businesses, for their employees and for their visitors, that you need to put on the mask. But I do not have the ability or the authority to apply that across the board to individuals who are just out and about in large gatherings. Don't have the authority. Don't have the authority, for example, to tell anybody to stay home. That has been taken away from all of the counties, all of the cities. We don't have that authority. The only thing that we can do at this point, other than the order for businesses and to mask up, is to engage, to utilize our voice, and to encourage people to do the right thing. That's the only thing that we are able on our end to do. Chief Pena.
Thank you, Mayor. So before I get into the enforcement aspect, I want to expand a little bit on what the Mayor and Dr. Persse mentioned in regards to the number of hospitalizations. Those patients primarily are getting to the hospital via 911, our ambulance service. In the last week, we've seen an increase in the call volume of about 20%, and that's significant. The downstream impact that these oversaturation in these hospitals is having on public safety is an issue, and it will continue to be an issue. When our ambulances are waiting at the hospitals for an hour plus, waiting to transfer the patients because the hospitals are saturated, that has an impact on us being able to service the next call for service, the next emergency call. And that has a domino effect on our capacity. So it's critical that we understand that. In addition to that, the impact to public safety is going to be felt in the number of personnel that fire department and the police department has available to come to work and fill the need for staffing. I'm not going to put a good picture on this. It is getting critical. The number of police officers that have tested positive for COVID-19 is at 146. 146 police officers have tested positive for COVID-19. 52 of those have since returned to work, but they do have 103 officers right now that are currently in quarantine, and they're not available to show up to work and staff these units. For the fire department, the numbers are even more pronounced. Over the last 10 days, our number of personnel in quarantine has gone up by over 140%. Just 10 days ago, we were at 36 firefighters in quarantine, and 2 of them that had tested, that were recovering at home. At this point, we have 88 firefighters. We have 2 firefighters that are admitted into the hospital. One of them is in ICU. So the impact of us not doing the right thing as a community is going to be felt in our ability to staff our units. It is going to impact public safety. We're already understaffed, both police and fire department. But as we worked to address that, we're dealing with the reality today. And when you take hundreds of firefighters or hundreds of police officers off the street for quarantine, it has a definite effect on our ability to staff our units and service the calls for public safety in this community. So again, we want to ask the community to do the right thing for Houston. Proper hygiene, physical distancing, wear your masks. It's not about control, it's not about being overbearing, it's about doing the right thing for this community and for those that are responding to your emergencies. So we want to ask that you assist us in assisting you all. In regards to the enforcement for the order, our profile and our posture is going to remain the same. The occupancy task force goes out based on complaints. We don't have the staff to go out and patrol, so we work based on complaints. We're averaging about 70 to 80 calls for service per day, every 24 hours. What the approach that we've taken from the fire department is that we're going to go out there and educate and gain voluntary compliance. We are not issuing, to this point, we haven't issued any citations. But we also haven't left the scene or the location without addressing the issue. Okay, I think that's a better approach, and we've been successful. We've gained almost 100% compliance in regards to the occupancy in these businesses. Primarily, it's been clubs and bars that are our main demand. But we will remain in that posture unless something changes. We are going to respond. We're going to try to gain voluntary compliance. We will assist the management and the building owners to get into compliance. But again, it's about the safety of this community. To individuals, if you go into these places and it doesn't look safe, I would recommend that you go and spend your money somewhere else where they are maintaining the proper hygiene and the proper safety measures. So with that, Mayor, that's my report. Thank you.
Again, social distancing, proper hygiene, sanitizer, washing your hands, putting on the mask. And again, just let it sink in. On Friday, we reported over 900 cases. On Saturday, we reported over 800 cases. And on today, we're reporting 1,789 cases. That's not Harris County. That is within the city of Houston. And during this entire pandemic, we never reported those type of numbers. Never. Okay? So it's serious. And we're moving in the wrong direction. So we have to reverse course. And one thing we know, this virus loves company and closeness. So we need to separate. Okay?